So, scenario, Sarah, a woman, arrived at the hospital after learning that her child had been brought in her by her husband X. She immediately became anxious, raising her voice in distress and demanding answers. What to do? Explain to Sarah what happened, reassure her, answer all her questions. You have 8 minutes and 40 seconds.
Yeah, that's a splenic hematoma, right?
No, splenectomy.
Anxious mother splenectomy. Okay, yeah.
Let me put the timer. 8 minutes and 40 seconds. Yeah, you can start, Habiba.
Hello, Miss Sarah. I'm Habiba.
Hi, doctor. How are you? I'm very upset. Let's start from the beginning. I don't want to hear a lot from you. Okay?
Okay. Can I ask you a few questions and inform you
No,
about
you
what
are not.
happened?
You are not the one who's supposed to ask question. I'm the one who's here to find answer. It's not you, doctor.
Yes, first. Go ahead. I want to inform you about your daughter. She came with with her father. She fell from a tree and injured her spleen, injured herself. We had to do ultrasound and imaging for her belly to see what's the problem.
Okay. Firstly, her dad is very abusive. I'm just letting you know that. And you said
Yes.
he came for a scan. What did the scan show?
The scan show injury for the spleen. The spleen is part in upper abdomen. I can draw it for you.
Yeah. Oh, uh, um, you so you need to draw it. Okay, show me then. Show me.
So the spleen is in this part of the abdomen and it's injured and it's bleeding. So we had to take her to emergency operation surgery. I'm sorry that you didn't see her first. I'm sorry that we was late to connected with you to be connected with you. But she had a serious condition, so we had to save her and take her to the operation.
So are you saying it's a very serious condition?
Yes, spleen injury could be life-threatening. That's why we took her to emergency operation immediately.
Oh, so she could die then.
Yeah, we needed to save her and see she is in
But,
safe.
but how did she injure herself, doctor?
She came with her father, which is he informed us that she fell from a tree.
Oh, okay. This man is crazy. So he informed you she fall from a tree.
Yes.
He is. I'm letting you know he's a drunk. He's an abusive father, and he obligated me to leave to let my child stay with him for a day. I regret it now. So I left her with him for just one day. And look what happened.
I'm
Just so sad.
I'm very sorry for that.
Yeah, I need to protect my child, doctor.
Hello?
I need to protect my child. I said.
Yes, just 1 second, doctor. They call me. I'm sorry. Yes. Yes, we will ensure that in situations like this, we take extra follow the guideline, and we connected the child protection, and we will ensure that your child best of interest will be met.
Um. Okay. Will my son require any medication after this operation, doctor?
If the spleen is removed, the child will need antibiotic maybe for lifetime.
Okay. What else? So he will just need antibiotic.
Yes, the doctor will discuss, we will be discussing with the team, and yes, he might need antibiotic for a lifetime, and maybe less than that, but at least 3 years.
Okay, okay. How long will the operation last for?
This is, I cannot actually we cannot actually detect the duration of the operation right now, but as soon as your child come out, we will inform you.
So you can't tell me when he will get out of the operation?
No, I cannot know the duration of the operation.
Okay, doctor, you are very useless, to be honest. There's like, I don't know why I'm wasting my time here. There's no point of just talking to you. You don't provide any answers.
Yes, I'm here to help you. Any thing that I can inform you with, I'm here to tell you.
All right. When can I see him?
As soon as he go out of the operation.
And when can I take him home?
We will ensure that your child health is met, he is in a good condition to go home. And as soon as the investigation and everything show that he is stable, you will go home with him.
With her? You're referring to me?
With him, with your child.
Okay, fine, fine. Okay, fine. All right. Yes. Yeah.
Okay. Can you summarize what we said?
I don't have any. I don't know what. I'm not happy to summarize anything. You just said you took the abusive drunk that came and brought my son, who's having an operation now, and you don't know when he gonna come out. You don't know when he gonna recover. You don't know how much the surgery will take. You don't know what's antibiotic should I give. So basically, that was a very useless conversation.
Okay. I will summarize with you what we said. I just want you to inform me that you understand everything. Your child came with his father. She fell out of tree. He fell out of the tree, and he injured his spleen. He needed to go to emergency operation. He will come out of the operation. You will see him next. He might need antibiotic for life, and as soon as his health is stable, you can take him home. We will ensure that he is safe, and we are with you to help you in anything. Do you have any questions?
No,
Okay. Can you summarize what he said?
no, I don't want to summarize anything.
Okay, thank you. Do
You
you
have-
understand what I said?
Yeah.
You have 50 seconds, okay?
All right, Muhammad, start quickly.
Habiba, very nice presentation. Let's review from the beginning. I'm so happy that you start by taking the permission to talk with Ali. But Habiba, while you start your conversation, Ali stand up, right? So why you didn't offer him to sit down?
Yes.
Why? Is a crucial point. Your patient is very stressed and frustrating and anxious. You should offer him to sit.
Yes.
After that, you should start your conversation. If your patient don't want to sit, then you should stand up. Same with your patient, okay?
Yes.
The other thing, when Ali asked you when the operation lasts, can you tell me when the operation lasts? You said no. Instead of that, show some empathy and feel sorry. I'm really sorry, Mr. John. I know you
Yes.
are worried. Don't answer the question immediately after the question.
Okay, doctor.
Ali also said, I'm not happy about your conversation. Also, you need to show empathy. I'm really sorry. I know this is a difficult situation you are passing through. Then answer the question. Don't answer the question before show empathy to the patient. Specifically for this session, Otherwise, you answered all the question correct, but you need to change your voice tone and you need to show a little bit of confidence while answering.
Okay.
Yeah. Ali, you can start with Habiba.
Okay, Habiba. Your patient will be very upset, will be screaming. I
أيوة
don't want to scream because I'm inside the hospital now.
أيوة
You come to the station, your patient will be standing, waiting for you. You will come standing, and immediately will, after they take your number, the examiners, there will be two examiners, a surgeon and a layman. The layman is not a doctor. He will just looking at your body language, how you speak, how you communicate with your patient.
Yes.
The moment you come to the room, the patient will start screaming. My name is Habiba. What do you know so far about your baby? Or you just take a permission? You already are starting to ask me question, doctor. Well, you are the one who's supposed to tell me. If you don't carry out the session while you're standing, you say, okay, Miss Anna, can you please sit and I will discuss everything you want with you. I don't want to sit, doctor. I don't want to sit. Um, please let's have a gentle conversation while you're sitting. If she sat, you're gonna sit, all right. But you should ask your patient to sit two times, and you shouldn't carry the consultation standing.
Yes.
If the patient refuses to sit, then you're gonna carry out the consultation standing. But you should show everyone you tried your best to make her sit on the chair. You said the scan show, but you should say the scan showed. You're talking about the past.
Yeah.
The scan showed this and that. Okay. You said to be connected with you instead of, um, I'm really sorry the operation went through before we call you. Not
Call you
connected.
أيوة
Yeah,
تمام
not connected. Connected, the very weak phrase. And you also
تمام
said we connected. You should say we discussed or we spoke or we called. You didn't mention a vaccination. I asked you what you're gonna do. You just mentioned the antibiotics,
antibiotic. Yes.
but you didn't mention the vaccination. You should give vaccinations, especially the meningococcals for
Yes.
splenectomy. Okay,
Okay.
so vaccinations, and also you should say the antibiotic could continue for life, but minimum for 1 to 3 years, according to the situation. Yes, and it's a very complicated criteria. You don't need to mention the details.
Yes.
Because I was upset and I was screaming at you, you forgot to mention my name multiple times during the conversation.
I forgot the name. I wanted to mention it,
Yes,
but I
yes.
forget it.
So in order for your performance in order for you to convince the examiner, you should say the name multiple times. Miss Anna, Miss Anna, Miss Anna, Miss Anna. I'm really sorry, Miss Anna. I understand, Miss Anna. That's why if when you review the recording later on, you will see that your performance is a bit rigid. Your tone is also the same because you don't know the name of the patient, so you can't basically communicate well to me. All right, which will affect your mark of professionalism. So mention the name, especially in the communication skills. Mention the name, change your tone. I know you are in the hospital or you are working or whatever, but change your tone. And this is the best way to practice while you are not on the best choice, on the best place. All right. So I'm glad you're practicing in the hospital. And as soon as he goes, you said, as soon as he comes out of the operation, or as soon as the operation is completed, we will let you know. You said I will summarize with you instead of I will summarize to you, or let's summarize what happened, or let's summarize what we discussed. It's not I will summarize with you. And I think all of these are minor mistake. The major one is you stood up, you didn't ask your patient to sit down. That's a major one, and you forgot the vaccination. These
Yes.
are the important stuff that you shouldn't forget.
Okay.
All
Thank
right,
you.
but
Yes.
otherwise, good performance. If you just practice it again, it's gonna be perfect.
Thank you.
Can
Yes,
we go to the
Muhammad.
next session?
Yes.
Okay, the next session is Warfarin Counselling session. Uh, let me check.
Fatma Ahmed.
Fatima, is Fatima here?
السلام
Fatma,
عليكم.
salam.
أنا والله ما حقدر أشارك معاكم، عندي دبان الصف. فشوفوا واحد غيره إن شاء الله. زحمة شديدة صراحة.
ما مشكلة المرة الجاية. اوكي.
إن شاء الله.
Okay, so
بس بسمع يعني.
فتح الرحمن.
Yes.
Warfarin session, please unmute your yes, you are unmuted.
Me.
Yeah, you have the last session. Okay, no problem.
كانت يسوي عمر I presented last time.
Okay, Umar, are you ready?
Umar, you said me, and then we can't hear you. Come on.
Umar.
He's muted now.
Okay.
Yeah, I'm with you.
Okay, let's start.
Okay. Scenario: an elderly gentleman, visually impaired and wearing dark glasses, lives independently despite having undergone mitral valve replacement surgery and battling colon cancer. He is currently taking warfarin and is scheduled for recurrent hernia surgery. Introduce yourself as a surgical doctor, use clear empathetic communication, address Mr. Khalid's concern, and clarify why heparin is used as a temporary replacement, highlighting the shortening duration of action. Okay?
Ahmed, can you
Okay.
be the patient?
Yeah, I
So I
will be
can
the
focus
patient.
with everything, yes.
Let me put the timer. Yes, you can start.
Hello, Mr. Khalid. I'm Dr. Omar, one of the surgical doctor here.
Hello, doctor.
I know you. Hello, how are you?
I'm fine. How about you?
I'm fine, alhamdulillah. I know you have a little concern about stopping your warfarin, and I'm here to discuss this concern with you. Is that okay?
Yeah, that's okay, doctor. My GP told me I should not stop taking it because stopping it could threaten my life.
Okay. Don't worry, I will take care of that, and I will explain it for you why we need to stop it.
Okay, carry on.
Okay. First, the warfarin is medication act to thin your blood to prevent any clot formation. Okay. And now you have a hernia surgery. We needed to stop before it to reduce the risk of excessive bleeding. Okay. And we will switch to heparin. It's also medication. It has the same.
Before switching,
same
doctor,
action.
to other medication, you say that I need to stop my warfarin, and I say to you, my doctor, my GP doctor said that I should not stop the warfarin. You know, I have heart surgery before, 10 years ago, and I am on warfarin for all these 10 years. So how can I stop this medication? I will die.
Yeah, Mr. Khalid. I really understand your concern, but I explain now for you. We will switch from warfarin to heparin. Heparin is the same medication, and it's
why you choose the heparin? So if the warfarin is the same act as warfarin, so why I should continue with warfarin?
Okay, that is a good question, Mr. Khalid. Warfarin is stay in your blood for a long time, 5 to 7 days. But heparin is stay at maximum 12 hours. That make us can control or allow us to stop the blood thinner safely before the surgery. And that reduce the risk of bleeding, as I said to you.
So, doctor, regarding the risk of bleeding, I need a civilian doctor to minimize this risk of bleeding so I can continue my warfarin instead of this heparin.
Sorry, can you repeat the question again?
I need experienced surgeon. So the risk of bleeding will be 0%. I know you are afraid from bleeding during the operation, right?
Yes.
So I need experienced surgeon that minimize the risk of bleeding to the 0%. So I can continue with the warfarin as my GB advised.
Don't worry about the experienced surgeon. All surgeon here, and specifically the surgeon who will do the surgery for you, is highly skilled and highly experienced. Okay, don't worry about this point. The point of control the bleeding is depend on the medication you take.
Okay, so when can I start taking warfarin again?
After the finish from operation, we will start it gradually switch back to warfarin when the level, and we will close monitoring your blood test. When the level of warfarin is good in your blood, we can stop the heparin and you can continue to use the warfarin.
Okay.
Is that good?
Yeah, that's fine. Do I need to stay in the hospital before the operation?
Okay, that's a good question, Mr. Khalid. You will need to come before 5 days before the surgery. That give us time to control your blood and close monitoring your blood testing until we switch from warfarin to heparin.
Okay, and regarding my antihypertension medication, doctor, should I need to stop it?
This is good question also, Mr. Khalid. Yes. No need now to stop the anti-anxiety medication. You can continue on
I
it.
said antihypertension medication, doctor, not anti-anxiety.
Antihypertension medication. No need now to stop it. When you come to hospital before 5 days, we will also can also switch from tabs to injectable medication.
For this hypertension?
What?
For this hypertension, you will transfer me from the tablet to the injection.
I will consult. I will discuss this problem with our senior, and we will see if they can let you continue to this tab, or they will switch to IV medication.
Yeah, thanks. Thank you.
Okay. Do you have any other question, Mr. Khalid?
No, I have no any questions, doctor. Thank you. Explained it to me.
Okay. Can you summarize the discussion? We will do it now to just understand, to just ensure you
yes,
you understand all I told you now.
Yes, you said that I should stop my warfarin medication because I am undergoing a surgery and the risk of bleeding is high. So you will switch me from the warfarin to heparin. Then you will continue after the surgery.
Okay, that's good, Mr. Khalid. Now I am sure you catch up all the important information. Also, I will summarize it for you.
Okay.
We will discuss the switch medication from warfarin to heparin before 5 days. You will come to hospital. Okay. And after the operation, we will start gradually to switch back from warfarin to heparin.
Okay.
We all here to support you, Mr. Khalid. And if you have any question, please feel free to ask any one of us.
Okay. Thank you. Thank you, doctor.
Can I start, Muhammad, quickly? Yeah.
Yes, you have 1 minute. Okay, continue.
Good, Umar. There's a couple of points. You said I'm fine. Alhamdulillah. Alhamdulillah أولا وآخرا. الحمد لله حمدا يليق بجلال وجهه وعظمته وسلطانه. لكن ما تقولها في الامتحان. Don't say it on the exam.
المشكلة متعود على
Yes. Hello. My name is. How are you? I'm fine. Especially you don't know which your examiner is. Is he Christian? Is he Hindu? Is he atheist? You don't know. So just keep it professional. I'm not saying Alhamdulillah is not professional, but just say I'm fine. Okay, and then say Alhamdulillah fi sirrat. Don't worry, I will take care of you. That was fine. You said your name multiple times. The you understood what you need to say. You following the school. You did a good job of transferring what's written to your words. But I would advise, if you can memorize what's written, is better than just memorize than saying. And this because you made a lot of grammatical mistake while you're speaking. That's why we prefer the memorization. You said I explain now for you instead of I will explain now for you, or I explained for you, or as we discussed. You also said that's a good question, which is very good. So whenever your patient asking you multiple questions, say that's a good question. But you said it twice instead of saying that's a good question. That's a good question. First time say that's a good question, Mr. John. That's a brilliant question, Mr. John. That's a fantastic question. So change your verbs. Change the way you say it to show you don't have a limited vocabulary. You said that make us can control. That's a very weak sentence. That make us can control. You can say that will allow us to control your blood thinner. That's why I want you, Omar, to memorize what's written for every single question instead of just trying to make you out of your head. You said heparin shorter the lifestyle than warfarin. You are right, but you should say the specific numbers. Heparin half-life is 12 hours, as written in the school. Okay, so and warfarin needs around 5 days. That's why we put you on heparin, because we can control it faster, because it has a shorter lifetime. Yeah, lifetime. Yeah. You said, can you summarize the discussion? We do it now. It's not you do it now. Can you summarize the discussion that we just had, or can you summarize what we went through, or can you summarize what we discussed? All of these are right. You said we will discuss the situation. You already discussed. You said, as we discussed, this is what's gonna happen. We're gonna stop the warfarin instead of we will discuss. You're not gonna discuss in the future. You already discussed it now. I think every single question you answered it right. You understood the concept. It's just how you say it. And you are not the first student. I have multiple students before. There's some type of student like you, Umar. They will just understand and try to say it in their words. That's okay. That's fine. But the issue is then you're gonna make a lot of mistake. So
I try to say it as in school, but
yeah, it's difficult. It's difficult.
Not difficult. But
Yeah.
I just do it one time.
Oh, that's mainly why. Yes. So, and for the communication skills, I say for all my students حفظ سنة ثالثة. بتعرف حفظ سنة ثالثة؟ Yes.
لا توصل للنتيجة دي. لازم.
Yes. And people think communication is easy, but communication is very difficult. Very difficult. I know some people who didn't practice the communication in their first attempt of the exam, and when they come to us, we did the practice like this. They said, we thought the communication is gonna be easy, and we're just gonna answer the question, and their performance is very bad because you need to pronounce right, you need to speak right, and all this stuff. But I think you understood every single concept. You answered every single question right. Just add more details. Heparin, 12 hours. Muhammad Akasha. Yeah, Muhammad Akasha, you can open the camera. I finished my point. But Muhammad, what do you want to add?
Yeah, I think you covered all the points I would like to mention. Just Umar, change your voice. And I'm so happy that you answered the new question I asked you, which is I need experienced surgeon to do this operation. So he will minimize the risk of bleeding to 0%. And you said it depends on the medication. And we already have experienced surgeon. So happy for your answering this question. Otherwise, as Ali said, you answer all the question correct. You need just to correct all these mistakes and
So
memorize
Muhammad,
what is in the school.
you just reminded me. So when Muhammad said I need experienced surgeon, you said don't worry about the surgeon. I wouldn't say that's a wrong sentence, but it's a very dismissive sentence. You are not putting your patient in a consideration when you say that. You say
No. I said all the surgeons we have highly skilled
yeah.
experience. Don't
Umar,
worry about that.
I know what you're meaning. We both Sudanese. We know exactly how to talk. But when I hear you saying, "Don't worry about the surgeon," you slightly dismiss what I'm saying. You should say, "That's a very valid concern, Mr. John. I want to reassure you that most of our surgeons here are very experienced. Instead of don't worry about the surgeon, okay? Don't worry about the surgeon is a bit aggressive. It's better to say, I do understand your concern, Mr. John. I just want to reassure you that all our surgeons are experienced. Okay? Akash, what do you want to say?
Yes, hello, Dr. Al, how are you? Fine?
Very well, yes.
He just make small mistake
Yeah.
for switching the heparin to the warfarin. We should continue heparin along with the warfarin.
Yes, on the bridging. I didn't hear it
That's
to
the
be
bridging.
yes.
Yes.
So
That's
from
mistake.
yes, I'm glad you mentioned that one. So if your patient is on warfarin, you stop and you put him on heparin. Heparin doesn't affect the INR. So you start warfarin and you measure the INR 3 days after starting the warfarin.
Yeah, we
And
start with heparin, then continue with warfarin.
Yes, no, you start the warfarin and the heparin. While you're giving the heparin, let's say you're giving the heparin, you start warfarin with the heparin. That's what we call bridging. And then you measure the INR in 3 days. You will find the INR start to pick up. When the INR reaches 2, you stop the heparin and continue with the warfarin alone. All right? And why
What's
we
the
do
mistake I do it here? I don't know.
Is that after the operation? You mean when we try and return back to the normal dose of warfarin?
Yes. And any one of you knows why we do the bridging? What's the pathophysiology? Why we start both of them together? Why we start both of them together instead of just starting the patient on warfarin immediately? Why?
Warfarin take time to
what?
بالعربي عشان يسهر الراس بتاعه بياخذ زمن.
طيب ما your patient is already on heparin. Your patient is already anticoagulated. Your patient is already receiving the anticoagulation. The idea is not that the warfarin takes time. No, the idea is totally different. So let me just quickly say it. Look, think about, so warfarin inhibit coagulation factor 1, 7, 9, and 10. You know that.
The vitamin K, yes.
Yes, the vitamin K relevant coagulation
factor, yes.
But it's also inhibit protein C and protein S. All right. Protein C, warfarin will attack protein C and protein S at the start. He will first finish protein C and S. Then will finish the vitamin K related coagulation cofactors 179 and 10. The issue is when warfarin attacks protein C and S, protein C and S are antithrombotic. They act as anticoagulation. So when warfarin finishes those two at the start and they have a shorter lifestyle, your patient will be in a thrombotic status. Do you understand? Just want to make this clear. So your patient will be in a thrombotic, which may lead to formation of clots. Look. I'm the warfarin. I act on protein 1, 7, 9, and 10 on this hand. And I act on protein C and S. These one are thrombotic. They cause coagulation. They cause clots. And this one, they are causing the coagulation. If I finish this first, I will finish this first. So the balance will be reduced. So your patient will be thrombotic. That's why you keep him on heparin. واضحة ولا أشرحها بالعربي؟
اشرحها بالعربي.
طيب Okay. Can we do the explanation at the end, Muhammad, just for the recording?
Yeah.
Fine. Okay. I will explain at the end.
Yeah, let us move to the last station. Fatah Rahman.
Yes.
Okay, CT scan, I think. So the scenario is Mrs. Matt, who asked to speak to your consultant, Mr. Baker. Mr. Matt, her husband, was admitted a few days ago due to abdominal swelling and was scheduled for a CT scan to further investigation his condition. However, technical difficulties with the hospital's CT machine have caused delays in opening the necessary diagnostic images. Mrs. Matt is understandable, concerned, and frustrated. What to do? Address her worries and provide her with information and support. Okay?
Okay.
Okay, so let me put the timer. You can start.
Hello,
Be
Ms.
the
Matt.
patient, Muhammad.
Yeah. Hello, doctor.
Hello. Yes, I'm Dr. Fatah Rahman, one of the surgical doctors working here. I'm apologizing for delaying in seeing Mr. Baker.
You are not Mr. Baker.
No, I'm not the one here.
No, I don't need to talk with you, doctor, please. I need Mr. Baker. I have an appointment with Mr. Baker. Please, I don't want to talk with you.
I'm understanding your concern. It is valid for me, but let me explain what happened with Mr. Baker. Mr. Baker, unfortunately, has been called for an emergency case, and he may take a long time to come back. So let me explain your concern, if you
So,
don't mind.
doctor, you said he called for an emergency situation, right?
Yes.
What do you mean by that? You mean that my case is not an emergency?
It is emergency.
I can't accept this point, doctor. I can't accept.
It is all right. But there is an emergency case right now in the operation, and he need intervention of Mr. Baker.
But he give me an appointment, doctor. Why
Yes,
then he give me that appointment?
For that, I'm apologize again for this inconvenience. I will inform Mr. Baker that you were here.
No, I really don't care, doctor. You really don't care about me.
And I'm caring, but I will arrange another appointment. I think it is difficult for you and difficult situation. I'm totally understand your emotions. Let me discuss and see what I can help and provide for you.
Okay, go on.
Okay, Mr. Matt, Miss Matt, your husband he came in with the abdominal swelling for the last 6 weeks, which showed there is accumulation of fluid, which samples were taken for analysis and showed presence of cancer cells. And we need to do a CT scan for more detail about the cancer. Unfortunately, we are experiencing technical difficulties in CT machine.
Yeah, first, doctor, can you tell me why the CT scan needed?
Yes, as there is a presence of cancer cells in the fluid, we need the CT for more details and information about the origin and extent of the cancers.
Cancer cells. You need the cancer.
Yes, unfortunately, Miss Matt.
Oh, doctor, I'm really sad about this news.
I'm really sorry for breaking that such news, but you must know the situation clearly.
So you mean this cancer need a surgery and complication, and he may die?
Your concern is understandable and valid, but surgery is considered only for those cancer is exhibiting potential improvement after surgery. In your husband's situation, the presence of cancer is in the fluid, showing exhibiting more aggressive type of cancer, and the surgery it is not significant, will not provide the significant benefits rather than increase his discomfort.
Very sad situation, doctor. I'm really sad about this news. Advanced cancer.
Yes, I'm sorry.
So,
I'm sorry.
doctor, I can't manage this alone. I need to tell his brother. Do I need that? Can you agree with me?
Yes, this is very concerned, but I'm preferring to wait till complete the investigation and to do on the CT. After the result of CT, and we have enough information, we can discuss next step, and we can involve the brother if needed.
So, doctor, you say the CT scan machine is now out of service. So, is there any alternative?
Brilliant, Miss Matt. Yes, we can perform abdominal ultrasound to see the liver and to see any suspicious spots and to assess the volume of the fluid. Other options, there is MRI, magnetic resonance imaging, which is give a similar information for CT, but we need to take Mr. Baker's opinion regarding that.
So, can you call him now and offer me this alternative?
Unfortunately, he cannot answer my call because he's busy in the operating room. Our last resort to transfer him for another hospital where there is CT machine is functioning.
Transfer? Why did not you transfer him to a suitable hospital from the start?
Valid question, Miss Matt. I need to reassure you that our small hospital and we are aimed to complete all necessary investigation for our patient within 2 weeks time frame. But in this situation, unfortunately, the CT machine is out of order.
But he's struggling to breathe right now.
Yes, Miss Matt. This is most probably because of the accumulation of the fluid in his tummy, which is bracing against his lung. So I will discuss with Mr. Baker to drain some of this fluid and prescribe medication to relieve those symptoms.
Last question, doctor. I believe he developed cancer because of his work environment, and I want to file a complaint against his employer. What do you think?
It is your right, Miss Matt, but this is out of my scope of practice. Maybe you need to contact the legal team. They will guide you on this matter.
Okay.
Okay, Miss Matt. Do you have any questions?
No, I have no any questions, doctor.
Okay, for clear explanation, Ms. Matt, would you like to summarize our discussion for me so I should be sure that you get and capture all the important information?
Yeah, of course. You said that my husband have a tummy swelling and there is a malignant or something cancer in his tummy, and you need to do this investigation, which is a CT scan. And now the consultant is called for an emergency. And you will offer me other alternative, but you need to discuss that with your consultant.
Brilliant, Ms. Matt. You seem that you capture all the important information. Let me summarize again, Ms. Matt. Your husband came to the hospital with abdominal swelling, which is the fluid analysis showed the presence of cancer. We need to do CT, but unfortunately we have current difficulty in our CT machine, and we discuss the alternatives. Thank you, Ms. Matt, for understanding, and I hope your husband will get recovery as soon as possible.
Okay, thank you. Thank you, doctor. You can go to the next station. You have 40 seconds.
All right, good, Fatah Rahman. Good, very good. I just want to add a couple of points. When she said you really don't care, you said I'm caring, but luckily you immediately rectified the situation. You immediately became very sympathetic. I'm really sorry, Ms. Jan, that's a difficult situation. But what should happen when the patient says you don't care? You should immediately say I'm really sorry, Miss Matt. I really care about you and your husband, and so you should sympathize first. But you corrected it. It's not wrong. You corrected it. Yes. You said we are experiencing technical difficulty. It's better to say we are experiencing technical difficulties. or technical issue. I'm preferring to wait till complete the CT. You should say I'm preferring to wait till the CT completion or till we complete the CT. You said we are aim. You should say we are aiming. We are aiming to do this and that. And that's all what I could catch. I think you answered every single question right. Even the new question about legal team and stuff. Yeah. So that's also you answered it right. I don't have any other comment. Muhammad?
Yeah, Fatah Rahman, you mastered the station. Very nice presentation. Excellent. Just at the beginning, you can ask me the information gathering. Can you tell me what do you know so far about your husband condition? Also, you said abdominal swelling instead of tummy swelling. And the last point, just change your voice a little bit. You change your voice many times, but I need you to change it more regarding this the question that I asked. Otherwise, very nice presentation.
You attack me a lot,
Yeah. Well, you manage it well.
Alhamdulillah.
Okay, I'm not sure if the screen if I draw on this table, will you able to see it?
Just focus it. The camera is yes, it's clear now.
Is that clear?
A little bit down.
The camera is not up.
It's not stable. That's why.
Adjust
Yeah.
the view. في touch. Let me stop the recording.
No.
The recording.
طيب.
محي don't write please.
عليك العام وحيدة.
Continue عادي.
يلا يا جماعة. بالنسبة لموضوع الوارفرين والهيبرين، اوكي؟ لو انا ده الدبليو دي الوارفرين ده بيشتغل في حاجتين، تمام؟ بيشتغل في بروتين هسميها بروتين سي ام بروتين اس، اوكي؟ وبيشتغل في فاكتور 1972 اللي هي دي شنو؟ 279 and 10. اقراها من ورا، ابدا اقراها من 279 and 1. alright؟
279 and 10 عادي.
ما 10 279 and 10 يس. طيب 197 and 2 ديل بيعملن شنو؟ ديل بيعملن ثرومبوزيس، كويس؟ ديل بيعملن ثرومبوزيس اللي هم ديل معتمدات على فيتامين كي، تمام؟ اصلا الوارفرين طريقه الشغل بتاعته شنو؟ طريقه الشغل بتاعته بيمنع الجابا كاربوكسيليشن وفيتامين كي، بيمنع الاكتيفيشن بتاع فيتامين كي، وبالتالي بيمنع ينشط الكواجوليشن فاكتورز المعتمده على فيتامين كي اللي هي 197 and 2. طيب بروتين سي ان اس ديل انتي ثرومبوتيك، ديل يعني بيمنع عن التجلط، تمام؟ معي لحد هنا؟
يس.
طيب الوارفرين بيبدا شغل على ديل فيرست، بيشتغل على ديل فيرست، تمام؟ بيشتغل على ديل فيرست ليه؟ لانه بيشتغل عليهم لانه التي لايف بتاعتهم الهاف لايف بتاعتهم شورطه، تمام؟
طيب
بعد ذاك بيشتغل على ديل بعدين بكم يوم، يعني بيشتغل على بروتين سي واس من اليوم الاول، بيشتغل على كواجوليشن 279 and 10 من اليوم الثالث وانت ماشي لفوق، ليه؟ لانه الهاف لايف بتاعتهم طويله. معاي لحد هنا؟
ايوه، يعني لو وقفهم يا علي معناها كده وقف السي والاس، معناها بيحصل ثرومبس. وقف الانتي.
ايوه لما تدي الوارفرين، نفترض انه العيان بتاعك اديته وارفرين طوالي،
ايوه
انت كده حتنتهي من البروتين سي والاس، حتكون الانتي ثرومبوتيك افكت بتاع بروتين سي والاس ده انتهيت منه، معناه البيشنت حيحصل له شنو؟ حيحصل له ثرومبوزيس.
ايوه
تمام؟
ايوه.
طيب وبعد ذاك نحن بنعمل شنو؟ بنقوم بندي الوارفرين مع الهيبرين، تمام؟ الوارفرين مع الهيبرين. الوارفرين بيوقف لك بروتين سي واس في البدايه، تمام؟ يعني بيمنع لك الانتي ثرومبوتيك افكت بتاع بروتين سي والاس، معناه البيشنت بيبقى لك ثرومبوتيك. الهيبرين بيقوم بيعالج الحاجه دي، بيمنع الكواجوليشن بالانتي ثرومبين 3، بيمنع الكواجوليشن فبالتالي بيتعادل.
ايوه
اليوم الاول، اليوم الثاني، اليوم الثالث. لما تحصل اليوم الثالث بتوقف الهيبرين ليه؟ لانه الوارفرين في اللحظه دي بيكون زي
اشتغل.
ما تخلص من ديل تخلص من ديل برضه.
ايوه اشتغل في الفيتامين كي.
فبالتالي دي الفكره الاساسيه اللي احنا عاملين بها الفكره دي، عاملين
ممتاز.
بنديهم مع بعض. واضحه يا جماعه؟
واضحه زي الشمس.
واضحة جدا، واضحة جدا.
طيب تمام جود. انا اي ويل جو ناو لانه المفروض امشي الحق الصلاه وكده. لو عندكم ديسكشن مع محمد او اكتبوه في الجروب.
ايوه
محمد انا في المستشفى لازم اطلع، عندي عيان لازم اشوف راسي.
انا ذاتي عندي مرضى والله. لكن يا شباب اي سؤال اعملوه في الجروب ان شاء الله انا اكون جاهز اجاوب باذن الله.
تمام يا محمد الصادق، ما شاء الله الناس الفكره واضحه يا شباب.
واضحة جدا والله، واضحة.
تمام. خلاص اي كويشن في اما في سكول اما في التليجرام.